This is related, my first question is related to the issue raised by Senator Dillon, and I will cite another report. He cited the Bloomberg report. I will cite the Nikkei Asia report, COVID-19 Recovery Index. It shows that the Philippines ranked last among the 121, not 53, 121 countries based on the trajectories of the recovery. Yung kay Senator Dillon, resilience. Ito naman, trajectories of the recovery from the pandemic. According to the report, our country has one of the lowest vaccination rates, since only 30% of the country's population have been fully inoculated against the coronavirus as of September 30 this year. Yeah. So, ang puntos na binigay sa atin, 30.5 points. Yung score kasi between 0 and 90. Ang nakuha natin is 30.5 points at 121st place. Now, my question is, in the light of these observations, yung Bloomberg, pati yung Nikkei Asia, obviously, what we're doing is not working, Mr. Secretary. So, mga tanong ko is, are we not making some adjustments or even some changes in the government's overall policy in our recovery efforts from the massive impact of the pandemic? Kasi kung hindi nag-work, kailangan may adjustment o may pagpapalit na gagawin tayo. Wala ba tayong ganon?
Madam Chairperson, we always make adjustments, and in fact, our adjustments have bore fruit. The faster group that made projections about 2 months ago, they showed the IATF that, for example, using the NCR, by September 20, if my memory serves me right, the active cases in NCR would have reached 150,000 to about 300,000 active cases. But as we can see now, even nationally, our active cases continue to plummet. And in fact, the NCR active cases is down to, I think, about 24,000 na lang po. And our cases continue to go down. In fact, this week, we have observed a 35% decrease. I'm just having it checked. It's a 32%, 25%, my apologies, 25% reduction from September 29 to 28 October 4. And the week prior to that, we registered a 20% reduction compared to September 23 to 29. Ang kaso na lang po natin October 7 to 13 is averaging 9,690 per day. This is the weekly, daily average number of cases. Nag-peak tayo, 20,946 per day. That was September 6 to 12. So ang laki po ng binaba, nangalahati na lang after a month. So this is proof that our adjustments are bearing some very positive results. So we continue with what we do, and we hope that these cases will continue to go down, less than 5,000 nationally per day, and NCR perhaps less than 1,000. So we will be watching this very closely. Every week we monitor, because we also want to open up bigger portions of the economy, because we understand the impact that it has had on our economy and joblessness, and reduced business activities.
Madam Chairperson, the Secretary mentioned that adjustments were made some 2 months ago. And in fact, September 6 to 12, yung sinabi niya merong some sabi niya nag-born ng fruit, So we were pala in a worse situation than as of September 30, because as of September 30, as the Nikkei Asia report indicates, tayong 121st of the 121 countries. So we were in a worse situation than as of September 30, Mr. Secretary.
As of September,
Would we
ang sabi ko
be
po,
worse than 121st among 121?
no, I was talking about, Madam Chairperson, yung pong September 6 to 12, nag-peak tayo ng
That's it.
20,946.
That's it.
Yung
So we
7
were in a
days,
worse situation than the worst.
we were in a
Kasi,
surge, Mr. Chair, Madam
I could-
Chairperson. We were
yes,
in a
yes.
surge. And if you compare us to Indonesia, kasi ang ginagamit po nila metric 7-day rolling average, this was used for infection management in the ranking. Note that in September, we had increased cases, nag-peak tayo, and this is not comparable with other countries that were already done with their surges. Nauna sila nag-surge ng July eh. Further, it did not use cumulative data where we could have seen a clearer longitudinal picture of the COVID situation, which is dynamic in nature. So yung mga bansa po, the country's common denominator affecting their rankings was the ravaging effects of the Delta variant, which impacted infection management and reopening progress. But let me just also say, Madam Chairperson, sana po kinumpara tayo kung kumbaga sa typhoon signal number 4 tayo. Kinukumpara tayo halimbawa sa Indonesia. Natapos na yung surge eh. Typhoon signal number 1 na siya, tayo signal number 4. So mahirap naman siguro 'yon. Dapat siguro apples to apples ang comparison na
Yeah, Mr. Secretary, we're talking of the same period. Indonesia rose to 54th, tayo 121. Because you mentioned Indonesia, ito yung sinasabi, the ASEAN country highest on the list was Indonesia, 54th, followed by Singapore, 70th, Cambodia, 76, Malaysia, 102nd, Myanmar, 105th, Thailand, 109th, Vietnam, which was the worst performer in the previous two rankings of Nikkei, went up to 118. So, mas masama tayo ngayon kaysa sa Vietnam, which used to be the worst. So, we're talking of apples to apples here because we're talking of the same period. We're not talking here of signal number 1 or signal number 4. We're talking of the same period. Indonesia used to be in a very bad situation because of the Delta variant, kasunod siya ng India. Pero yon, ang tanong ko nga is, anong adjustments yung ginagawa natin, And yung ating economy is getting a beating, Because ours is the eto sinasabi rin sa report. Ours has been dubbed as one of the countries with the longest lockdowns. So probably yung long lockdowns hindi rin nagwo-work. Nakakasama pa sa ekonomiya. At the same time, hindi naman nag-i-improve yung ating COVID situation. That's exactly my point, Mr. Secretary. Kaya kung ganong hindi nagwo-work yung ating, di ba may kasabihan na, if ain't broke, wag i-fix. Pero mukhang kailangan mag-fix tayo ng konti rito sa ating overall policy, yung ating overall strategy. Hindi po ba, Mr. Secretary?
Tama po kayo, Madam Chairperson. In fact, yung isa sa mga adjustments na ginawa na natin ay yung alert leveling system natin for granular lockdowns. Hindi na po tayo dito sa NCR mag-community-wide lockdowns at kanya po ginawa natin mas localized ang mga lockdowns at meron na po tayong bagong leveling system, alert level ang ginagamit natin para mas magawa ng mga local government units yung kanilang strategy patungkol sa prevention, sa detection, isolation, treatment, reintegration, and also ramping up now that we have more vaccine doses arriving, ramping up our daily job rate. We are looking at increasing our job rate to, kasi ngayon nagpa 500,000 tayo pero hindi pa consistent. We want to bring it up to 750,000 and the goal is 1 million per day jobbing. So ito po yung mga adjustments sa Madam Chairperson na ginagawa po ng ating pong DOH and the IATF.
So what you're saying, Mr. Secretary, in the next Bloomberg and Nikkei report, medyo mag-i-improve yung ating situation because of the adjustments that you mentioned. Kasi
Tama po kaya?
yung data ninyo, sakop na nung report eh. Sabi nyo, 2 months ago, naggawa na tayong adjustments. And then September 6 to 12, meron tayong ginawa mga konting changes. So we're expecting that in the next Nikkei Asia report and in the next Bloomberg report, we'll see the Philippines having some notches in improving our situation.
Madam Chairperson, tama po. That's our goal to improve our ranking. And we are also writing to Nikkei and Bloomberg to tell them that the evaluation that was done to the Philippines, September kasi nagsisearch tayo. Taas ng, dahil na nasabi ko, no, our data shows 20,000 plus our daily average number of cases. No? And by this time, ang Indonesia bumagsak na. Oh, by the way, Indonesia had reached 40 to 50,000 cases per day. At harinawa, awa ng Diyos, hindi naman tayo umabot sa ganung kataas daily, average daily cases po natin. Tsaka nakikita na po natin, pati yung active cases natin, asa 90,000 plus na lang tayo. We went up as high as about 150, 160,000. So tuloy-tuloy na po ang pagbaba, and hopefully we can improve our ranking. Thank you very much, Madam Chair.
Thank you. Mr. Secretary, kayo nang sabi ng apples to apples. Yung number of cases sa Indonesia, hindi pwede i-compare sa number of cases sa Pilipinas because of the population. Pag per capita pag-usapan natin, hindi ganun kasama yung situation sa Indonesia compared sa atin. Anyway, I will not belabor that issue, Mr. Secretary. Let's go to another topic. Before we tackle the issue on vaccination, this is not part of the NEP, but still, part din ito ng mga budget books, yung BASF, Budget Expenditure and Sources of Financing. On off-budget accounts. Yung off-budget accounts under the BASF, ang na-reflect dito yung retained income receipts for the DOH from all its retained hospitals.
Yung mga
Amounting to please correct me, kasi ako initially when I saw this figure, I thought typo. Pero hindi ako makapaniwala ng yung BASF magkakaroon ng typo. 439 billion. Ito yung naka-program for 2021. With the following sources, nature of revenues, hospital fees, drugs and medicines, rent, lease, etc., etc. So are you confirming this, Mr. Secretary?
Pasensya na po, I'm still looking at it.
448.439 billion pesos.
Million.
2021.
Billion.
Billion. Under your off-budget accounts.
Covering 2021.
Program po ito for 2021. And ito, we analyzed this, Mr. Secretary, because previous years, ito yung historical figures of the same account. Reported balances as of every year end as follows. 9.092 billion in 2017. Ayan yung mga balances. Meaning, ito yung naiwan. 6.156 billion in 2018. 7.667 billion in 2019. 8.035 billion in 2020. We're trying to find an explanation for this, because suddenly nag-surge, nag-spike yung 2021. Now, since ito yung mga nakukuhang income from hospitals, ang isa lang logical explanation na naisip namin dito, ang surge ng pandemic ng COVID-19 talaga nasa 2021 because 2020 ang program ninyo nasa 17.2 billion. Well, nag-start lang naman tayo ng COVID March and nag-start tayo mga 1,000, 2,000. But since most of the income na nadiderive ng DOH from the hospital, that's why I requested the hospital directors to stay put for them to confirm. Kasi at any rate, ito, nire-remit naman nila lahat sa DOH ito. So nang nag-search at talagang ang occupancy rate ng mga hospitals, government hospitals, even private hospitals, talagang over 100%, di ba? So rightly so, talagang mag-spike yung programmed receipts or income to a high of 448 billion pesos. Now, question. Kung titingnan natin yung historical data, lagi kayong merong mga balances, ano? And before I proceed to my next question, I'd like to review yung ito yung December of year end, ano? 2016, meron kayong balance na naiwan 4.7 billion. 2017, 9 billion, and so forth and so on. Question, kanina nung nagbi-briefing yung mga government hospitals, naniningil pa rin sila sa pasyente. Eh, ang laki naman ng inyong income from the hospitals. These are government hospitals and tayo lang yung few countries na walang zero billing sa government hospitals. You know, we can talk of Cuba, we can talk of other countries na yung mga citizens nila pag na-confine sa hospital, especially government hospitals, walang binabayaran. Now, it doesn't make sense to me, Mr. Secretary, na hindi nyo nga nagagastos yung off-budget accounts. And yet, we're still punishing our patients by, collecting or billing them, especially during COVID, na ang daming nawalan ng trabaho. Kaya ang nangyayari, alam mo, ang takbuhan nila, mga senador, mga congressmen, mga mayors, mga governors. And yet, I find it, rather cruel for government hospitals to be charging patients when in fact, yung off-budget accounts nyo lang, napakalaki ng natitira. So kindly give us an explanation, Mr. Secretary.
Madam Chairperson, I am really dumbfounded by this figure of 448 billion. Kasi in fact, ang report ng mga yung mga
program po ito. Wala pa sa inyo ito kasi ang I understand, ginagawa itong program na ito mid-year. So this was a program, I think, sometime in June of 2021. Pinograma ito based on historical data. And since there's a spike, biglang nagkapunuan yung mga government hospitals, talagang ang expectation ng naggawa nito, because I cannot doubt the figures being reflected under the BSF, one of our budget books. Hindi nagkakamali yan. Laging accurate yung kanilang datos. So, but that's beside the point. Kalimutan na muna natin yung 448 billion as program in 2021. Ang sinasabi ko, lagi kayo may sumosobra year in, year out. Yung year-end balance ninyo, laging meron naka-indicate na billion. But why would we still charge patients at the time of a pandemic ng kanilang hospitalization fees? Hindi ba dapat at least man lang mag-cancel out yung kinikita ng DOH, ng gobyerno, medyo ipasa naman natin to cushion yung paghihirap ng mga kababayan natin na nakakonfine sa hospital. Hindi po ba? Parang there's something wrong with the management of government hospitals. Kumikita naman, bakit nagcha-charge pa rin tayo tapos hindi nagagamit? That's my point.
I agree with you, Madam Chairperson. Tama po si Senator Ping. Yung pong policy kasi natin, actually, no balance billing ang policy natin eh. Even PhilHealth will vouch for that. Itong mga highly specialized hospitals, ito ang tingin ko sila ang meron co-payment or balance billing na ginagawa. But it is more an exception rather than the rule. So,
no, Mr. Secretary, this is the rule. Kasi year in, year out yan eh. It is not an exception. It is the rule. It happens all the time. Wala tayong zero billing o wala tayong subsidy man lang sa mga pasyente, and yet, you're not spending. So ang tanong dito, anong ginagawa nyo doon sa pera na yan? Na sobra-sobra. Hindi sobra kung ating ilalaan doon sa mga pasyente na umaasa sa government hospitals. Actually, hindi sobra. But hindi natin ginagamit, kaya lang, charge pa rin natin yung mga pasyente ng mga government hospitals. Hindi po ba parang may konting konsensya issue rito? We're not using the budget and yet we're charging patients.
Meron po kasi tayo sa Universal Healthcare Law, yung 10% ng bed capacity ng ating mga government hospitals ay mga private beds. Tapos 90%
That's
service
not my
beds.
point, Mr. Secretary. That's not my point. That's beside the issue. Alam ko
Yeah,
naman na we
tama
need
po
to
kayo,
reserve yan para
Madam
sa mga
Chairperson.
VIPs. Pero ang
We'll look
sinasabi ko
into
yung
this.
charging, yung billing.
Yes, sir. We'll look into this,
Please.
Madam Chairperson. Malaki nga ito. At we will ask the hospital. Andito naman po yung mga hospital chiefs natin. They might be able to chime in. But anyway, we will look
Yes,
into this and have
please.
it reviewed right away, Madam Chairperson.
Yes, please. Kasi
And
alam
DBM.
nyo, hindi bali na mag-zero-zero yung off-budget accounts ninyo. Pag year-end, mag-zero yan, nagamit natin para ma-subsidize, matulungan yung mga na-hospital na admit sa mga government hospitals. Pero para hindi gamitin, and we continue to charge.
Yes, Madam Chairperson.
Yes.
We will look
Can we
into
hear
this.
from the directors of government hospitals? Bakit ganito?
Andyan po sila. Thank you, Madam Chair.
Like them to respond now. I can call on them now to respond.
Yes, please.
Quick
Madam Chairman.
responses from NKTI, from Philippine Heart Center, sige po, Lung Center, and Philippine Children's. Mabilisan ho na sagot, no? Dito, I suppose you're listening naman as we told you to stay there, no? So, NKTI, Dr. Liquete, are you there?
Just a little background, Madam Chairperson, ano?
Yes, go
Yung
ahead.
items na kung pwedeng paggamitan itong off-budget accounts, dalawa lang. CO, capital outlay, and MOOE. I guess, kung sa billing natin i-charge, papasok yan doon sa MOOE. So walang problema sa technical malversation dito. And when we talk of 9 billion, 8 billion, 6 billion, pag year-end, malaking tulong sana ito doon sa mga na-admit, especially those, yung mga nangangailangan sa mga government hospitals. Yes, please respond.
Let's start with NKTI. Dr. Liquete, are you there?
Yes, Madam Chair. Ang service cases namin are no balance billing actually, even for our COVID cases. No balance billing for service cases.
Ang dami ko pong kakilala na ang laki ng binabayaran, kaya nga nangungutang, kaya nga sila humingi ng tulong sa mga kung kani-kanino kasi ang laki ng bill nila sa government hospitals.
Can I
Yes,
explain
don't
on
tell
some
me, ma'am.
cases? Because some cases they start as pay patient, and then when they cannot afford anymore, then they would be referred to the social service. But then before they are referred to the social service, they have first to settle their bills as a private patient. Maybe these are the patients who ask help from your offices.
Yes, ma'am. Ang problema kasi, pag na-admit yung patient, sinasabi walang available na remdesivir, walang available na ganitong gamot, so bibili sila sa labas. Ganyan po nangyayari eh. And yet, we have savings, we have balances. Yan po yung aking issue rito. Hindi natin gamitin yung off-budget accounts na sinisingil na natin sa mga hospital, seminar fees, kung ano-ano, but hindi natin gamitin to the fullest yung mga off-budget accounts para masubsidize yung mga pasyente na napipilitang bumili ng, ang tawag niyo po rito, emergency purchase eh. Ako, I had my own experience sa Biluna. Ang sweldo ko nung second lieutenant ako, 320 pesos. Pag may kailangan mag-emergency purchase kasi di umano, walang available doon sa hospital. And yet, may pera naman pala. That's my main issue here, ma'am and Mr. Secretary. I think a review of this off-budget accounts is in order para maipuno naman natin doon sa pangangailangan. Kasi tawag nga natin government hospital eh.
Question lang.
Meron pa dyan, yung mga source, tinawag kanina sa briefing, merong congressional insertions, meaning, mga 100 million yata nakita ko doon. Meaning, ito yung mga soft tawag dito, yung soft projects, nilalaan niya ng mga legislators sa mga hospitals. Bukod pa to doon, paano yung walang kakilalang senador, walang kakilalang congressman, walang kakilalang director ng government hospital, magbabayad sila. Only to find out na ganyang kalaki pala yung balances pag year end. Anyway, I yield to Senator Dillon. Maybe he
Yes,
wants to say something.
just one question, Senator Ping. Thank you very much. So this appears to be public funds. These are paid to public hospitals. From this
Yes, sir.
presentation, 448,439,207 pesos. I'm sorry, is it billion, sir?
Billion.
Million or billion?
Billion.
Billion. 448 billion.
Thousands. That's
Yes.
for
Okay.
2021.
Yes, yes. And the expenditure is 16 billion. So you have a balance of roughly 430 billion, rounded
Yes,
off.
sir.
What happens to this huge sum of money? These are public funds. How is this spent? And who authorizes the spending of these funds?
Maybe a related question is, how is this reported in the books of DOH?
Yeah, we just asked NKTI, Dr. Liquete, if one, no? Senator Ping, would you like to hear the others? But the question of Senator Dillon remains, and that goes to DOH. Siguro, sir, Secretary Duque, maybe you can respond to that. And then Senator Ping, let me know if you want to just hear the other heads of the specialty hospitals.
Yung 448 billion, ngayon ko lang ito nakita sa buong buhay ko eh. So I have to check this. We will review, Madam Chair, because the figure just really, I find it very difficult to fathom. But we will do that. Right now, I have instructed my staff to look into this so that we can give you feedback right away.
Yes, sir. We did not invent this figure.
Yes, I know, Mr. Chairman,
It's a
Madam
budget
Chairman.
expenditure and sources of financing. One of the budget books submitted to the Congress.
Yeah, we will have it looked into. It's being looked into as I speak, Madam Chairperson.
And for the record, dear colleagues, most, if not all of these specialty hospitals, we're just using them as examples, no? Because I believe Senator
Hello, nalagay din ni Kuan kay kanay Kuan
relative no, DOH hospital billings.
RD ani RD Gulon
Sorry, somebody's mic is on.
HPEP ba?
Somebody's
Performance
microphone.
Ano yun?
Ewan ko. Anyway, I was just commenting, Senator Ping, that all of them are asking for additional funding for assistance to patients. So just to kind of try to figure out where is it, I think dun sa executive directors ng mga specialty hospitals, well, on paper, I guess wala sa kanila kasi they're asking for funding for and normally they get it via congressional insertions, no? In their presentations, nandiyan yan, humihingi sila ng assistance for patients. But I'd also like to highlight what Dr. Liquete said, na because I've come across it many times, perhaps kayo din po sa mga offices nyo, really the problem lies with those, I mean, a big part of the problem is for those who come in as private patients nga. And they would ask our office for assistance, di ba? And then when we try to help, malalaman, alam na natin na yung policy is, because under the UHC law, it's a no balance billing for indigent patients. So unless they qualify as indigent or they agree to be in the ward, it presents a problem on how to provide financial assistance from them. I'm just saying from experience and under the UHC law. Senator Ping, go ahead.
Madam Chair, there's a separate budget for indigent patients, 17 billion assistance to indigent patients. So separate yun. We're only talking here of the off-budget accounts na in billions, ano?
Noted. Naman po.
Yes. You know, I'll speculate why this happened. Many of these hospitals are considered as GOCCs, government-owned and controlled corporations. They, the payments made to them are corporate funds, or what is made to appear as corporate funds, and therefore they retain them. That's one explanation. They're considered themselves as GOCCs.
Madam Chair, can I just clarify something here? The
Yeah.
four presentations, Madam Chairperson, of the executive directors, no, heart, lung, kidney, in particular, have all had the same common observation that noong 2020 and up to now 2021, talagang bumagsak ang kanilang mga non-COVID patients. Di ba? Si Dr. Liquete said that the non-COVID patients plummeted, also for the heart center. Their presentations clearly showed that. So I'm really confused, Madam Chair.
Madam Chairperson?
Senator Nancy, I will only recognize you if you will shed light and not further.
Yeah. Just for clarification, I think yung amount na nakalagay is for, it also covers all DOH retained hospitals, di ba? Hindi lang siya yung specialty hospitals.
You mean Senator Ping's presentation? That was all.
Yes.
That was all. That's why
All.
I pointed out that we're just asking the specialty hospitals, since they're here, to explain from their own experiences. But Senator Ping, that was all, di ba?
Yes. Let me read to you yung special provision number 2 under the 2021 GAA. Nakalagay dito, hospital and other health facilities income, in addition to the amounts appropriated herein under the GAA, all income generated from the operation of specialized hospitals, medical centers, Institute for Disease Prevention and Control, including drug abuse treatment and rehabilitation centers and facilities, blood centers, facilities, or blood stations, blood connection units, blood banks, etc., national, subnational, and regional reference laboratories, public health laboratories, and other hospitals under the DOH. Ito yung tinatawag na retained hospitals. Shall be deposited in an authorized government depository bank and used to augment the hospitals and other health
It's usually
facilities,
income.
MOOE, and capital outlay requirements. So, now ang tanong, saan bang bangko nakadeposito ito? At saka, magkano kinikitang interest nito? Baka naman hindi nagagastos kasi kumikita ng interest sa bangko, parang sa PITC. Baka naman kaya natin tinitipid. Sa akin, dapat mag-zero ito eh. Pag year end, dapat zero balance. So, na-maximize natin yung gamit to attend to patients being admitted into government hospitals. Hindi po ba, Mr. Secretary? Di ba yun ang dapat
Agree.
mangyari?
Yes, sir. Anyway, pinapatingnan ko na po ito. In principle, I agree with you. Dapat talaga gamitin. Pero sabi nga ng mga executive directors, meron daw sila pinupondohan din na yung quantified free service. Can you explain that, Executive Director Liquete? O yung quantified free service na binibigay ninyo sa mga pasyente? Madam Chair. Thank you.
Yes, Madam Chair. Mainly, these are, a patient or maybe a private patient, you can have him a quantified free service, a discounts in terms of unfunded discounts. Nandun yung mga senior citizen, PWD. So doon ho yun napupunta sa quantified free service. So after 2 years, saka lamang they can reimburse, DBM reimburses us. So that's a lot because at NKTI, we have a lot of PWD, senior citizens, mga unfunded loss ito. Your OFW also, especially if they are in our charity or even in the pay. Recently, we used to be 70-30 pay and then service. Now it's almost 50-50. So we have a lot of service cases.
Madam Chairperson, ito yung naging basis kasi niyan eh. In 2003, merong joint circular, DOH, DBM. Sinasabi rito, provides that hospital income shall be used to augment the MOOE, including repair and maintenance of existing hospital facilities. It also provides that at least 25% shall be used to purchase and upgrade hospital equipment used directly in the delivery of services. Now, ang tanong, kindly elaborate about the income from the services to patients. Kasi serbisyo nyo sa pasyente, government hospital, paano kayo nakakaderive ng income dun? That's my point. Kasi sumusobra yung inyong budget accounts and yet you're charging patients.
Madam Chairperson, yung PhilHealth reimbursements ang source ng funding nila ng pera. For the most part, I believe on top of the budgets they receive through the GEA, yung PhilHealth reimbursement, Madam Chair.
Iba yung PhilHealth eh. Anyway, I have the same attitude kay Senator Dillon. I'd like to yield the floor to the other members who want to ask their questions. Marami pa akong tanong pero isang second round ko na rin. Thank you, Madam Chairperson.
Okay, thank you very much, Senator